Welcome to Nkhoma, in the center of Malawi, the warm heart of Africa. Nkhoma is located off the main north-south highway, 50 kilometers south of Lilongwe, the nation's capital. Early missionaries from the Dutch Reformed Church in South Africa evangelized in the region beginning in 1889. A small clinic was first built at Mvera in 1903, and in 1915 a hospital was established at Nkhoma, the headquarters of the Synod.
A chaplaincy program started in around 1889 by the missionaries. We are 5 in our office, myself and the 4 assistants. So what we do is we visit the sick, we help their families and their staff members, and we are also engaged in palliative care and also community health evangelism and mental health. So we have seen the hand of the Lord working through the hospital.
The hospital has grown considerably over the 107 years to a 280-bed specialist teaching hospital with 11 health centers and outreach programs reaching an immediate catchment population of 89,000 and 465,000 for referrals. The COVID-19 pandemic has impacted Malawi and the hospital over the last 3 years. Nkhoma was chosen as a coronavirus screening and isolation site, but during the pandemic, admissions and attendance rates dropped. In 2021, there were on average 1,000 admissions and over 3,000 outpatient visits each month. There were also more than 3,200 births at the hospital. Nkhoma Hospital is a training center of excellence. We partner with the Nkhoma Nursing College to provide in-service training for student nurses and midwives. The college has 346 students. In 2016, Nkhoma Hospital was chosen by the College of Medicine to provide a 4-year specialty training in family medicine for Malawian doctors. Dr. Patrick Chisepo, the first resident graduate of the program, has now joined the faculty of the program. Pan-African Academy of Christian Surgeons, PACS, program has helped to establish the training program for surgical residents. Dr. Yamakani Lembi works with a global team of 5 specialist surgeons to train residents to help meet the growing need in surgical care.
We appreciate so much the support that we have from the entire hospital management team and the hospital director.
One of the most notable programs at the hospital has been the eye department. This program, currently under Dr. Vincent Moyo, has been providing eye surgeries and services since 1955 to Malawians.
Traditionally, we are doing about 2,500 patients per year.
Clinical and support services offered at the hospital include general medicine and surgical, maternity, pediatric and under 5s clinics, dental, physiotherapy, palliative care, mental health, and spiritual support and counseling. Other services provided by the hospital include cervical cancer screening program, palliative care outreach program, mental health outreach program, community health evangelism, and a program to revitalize primary health care throughout the region. Nkhoma Hospital is also participating in a quality improvement program to maintain high-quality standards in all services. Several additional projects are underway, such as a new oxygen generation plant, renovated and new staff housing, additional backup electricity generation, and plans for a new surgical and intensive care building.
Nkhoma Hospital has around 324 employees working at the institution. We are also managing health centers. We have over 200 employees, so we are almost 600 employees. So all the HR activities, they are done in this office. We have also challenges as an institution. Some of the challenges, we have shortage of houses. So most of the times it's difficult to accommodate staff here. The other challenge, as the hospital is also expanding, we need staff, qualified staff.
The hospital has got three main streams of funding. The first one is the government grants for salaries, which accounts for 40% of our revenue, and 30% from the fees which we charge the patients, and 30% from donations. The operational budget on a monthly basis is $156,000 US. In terms of expenditures, staff cost is the major expense, which takes about 70% of our total operational expense. And medical cost, which is the purchase of medicines and other medical supplies, takes about 20%, and 10% is what goes into overheads, things like electricity and the water and other expenditures, including motor vehicle learning expenses. On a monthly basis, we are always having a deficit of $34,000. So it's indeed very challenging, but by God's grace, the hospital is still continuing in its operations.
Please visit our website for more information and come visit us. Thank you.